Well, this morning, news that could literally save your life. Every day, 2,600 Americans will die of cardiovascular disease. That is one American every 33 seconds. More deaths than all cancer combined. And 60% of all heart attacks occur in people with no prior evidence of coronary heart disease. That could be you. That could be me. Joining us this morning, two people trying to save thousands of lives and succeeding. Dr. Bradley Bale, clinical assistant professor at Texas Tech School of Medicine and nurse practitioner and adjunct professor at Texas Tech, Amy Doning. Good to have you both with us this morning.
Well, thanks for having us in this morning.
Absolutely. Okay, Dr. Bale, you all are really working on a shift in how we prevent heart attacks. What's the key component?
Yeah, one of the key components is certainly looking for actual disease, this silent but potentially deadly collection of cholesterol in the wall of the artery. We can identify that silent disease before it's deadly and then monitor that disease over time as we put treatment to it. So that's one of the keys, not just treating numbers, but actually treating disease. And then we've developed ways of the underlying cause of that disease and getting to the root cause, then setting optimal goals of therapy, not being satisfied with the standard of care, which is really more like a C. Say for blood pressure, the standard of care we know isn't optimal, and if you really want to prevent heart attacks and strokes, we need to be going for optimal care, and then to personalize care more and more with genetic testing.
Yeah, the real wave of the future. Speaking of numbers, he was mentioning cholesterol. A lot of people get their cholesterol numbers back. Maybe they're just a little high or maybe they're good. And so they think they're doing great, but that's not necessarily so. Why, Amy?
It's not. I mean, a lot of the focus has mainly routinely been on LDL alone. And the cholesterol panel is extensive in that we can look at different ratios, particularly our HDL, especially for women. It's a major player in the area of heart attack and stroke prevention.
You mentioned finding the problems in the arteries, and you have a method which it's a simple ultrasound, is that right?
Yeah, it's a special mode of ultrasound called B mode, and it's a test called carotid intimal thickness testing. It's been used in research actually for 20 years, and it's still the primary endpoint of huge studies that are going on, and we're one of the first to start using it clinically, not just in research, but with real patients. And it's a wonderful tool to find that silent, potentially deadly disease. And then as you put treatment to it, it's a cheap, easy, painless test to repeat to see, hey, is the treatment working?
And Amy, you all are training doctors all across the country, which is exciting. So when we go to our doctor, the treatment and care, a lot of it may be result of your works and your research.
We would like to think so, yes. We're making a difference out there, definitely.
And you even got to present your findings in Rome, right?
Yeah, Amy presented as well, and that was in the summer of '06. With that test we're talking about, we actually have been able to show when you treat comprehensively and optimally, you can start to clean the artery up. So this disease that's in the wall, you can actually start to see it decrease.
Well, we have a lot of important questions that you need to ask your doctor, some other things that you need to do. In fact, we're going to be with Amy and Dr. Bale on Sunday Journal this Sunday, so be sure to watch that if you can. Also, check our website for more information. We have a link to their website, much more information on this. We've just kind of, scratched the surface here this morning in our limited time, but for those of you out there, who may have heart disease, and it is many of us that we, don't even realize it, more information, you can head to totheadvocate.com/tune-in. But stay with us. Coming up, speaking of being heart healthy, we have the best crab cake recipe. I have tried a million of them, it seems like, and this is the best. Great heart healthy and some other great Lenten secrets from our kitchen to yours after this.